Welcome to this week's episode of Talk of the Town. My name is Philip Swicegood, and I am back with my good friend and co-host, Dr. Kenneth Harper from Vein Specialist of the South. Now, if you just saw a vein pop up and you want to get some questions, hey, especially with summer just around the corner, give Dr. Harper and my friends at Vein Specialist of the South a call today, and they will get you the answers that you deserve. We also want to thank this week's presenting sponsor, which is Piedmont Macon, for sponsoring this show and making this opportunity possible. Piedmont provides comprehensive, quality healthcare for all of your medical needs. Thanks so much to Piedmont for making a show like this possible. Now, if you're just waking up on Saturday morning and you've turned on 13 WMAZ and you're wondering what in the world is Talk of the Town, here's what you can expect week in and week out. A conversation between me, Dr. Harper, and someone in the community who has a story that we think you should know about. This week is no exception because we are here at Piedmont Macon Medical Center, where we are with Mr. Steve Daugherty, who is the president and CEO of Piedmont Macon Medical Center and Piedmont North Macon Hospital. Steve, thanks so much for joining us this week.
Yeah, thank you for having me.
So, Steve, Piedmont has been in town now for 5 years, correct?
Yeah, it is hard to believe that 5 years has gone by so quickly.
5 years here in Middle Georgia. Talk to us about some of the changes that have come to healthcare since you guys have been able to come to town.
Well, you know, the one change that most people don't recognize, and I guess we haven't talked about it enough, is that we're now a 501c3 not-for-profit health provider. So we are now an asset of this community, and we try to be good stewards of the asset that these two hospitals are for Macon and Middle Georgia.
Yeah, for people who don't know much about that, what does that really mean?
Well, it doesn't mean we don't make a profit, because we have to make a profit to invest and hire people and bring physicians here and upgrade the hospital. But in exchange for that not-for-profit status, we don't pay some taxes that some businesses do, but we do other things that impact the community: health screenings, education, and things like that to offset the tax break that we get. And so we return that $2 for every $1 of tax break that we get.
And y'all are heavily involved in the community with things that make a difference. And so people notice that, and we really do appreciate it. So when you're, as the leader of Piedmont Macon and the facilities, how do y'all determine what the needs are, and how do you plan for the future?
Well, one thing we do is a community health needs assessment. And so we get demographic data. Obviously, we know what our patient population looks like, but we go and meet with key individuals in the communities that we serve and talk to them and see what they think the gaps are. And then we try to match that up with the demographic data and then look at what services we either need to expand or new services that we need to bring.
So tell us about some of the like the hospitals you have, the clinics. You were sharing a little bit about it. I was very surprised. I wasn't aware of all of those. So where are you?
Yeah. So prior to Piedmont's entry here, we really just had two hospitals. Those were the only two access sites into our healthcare. Since Piedmont in 5 years, and it's really even surprising to me how rapidly we've been able to bring new services. We now have 6 urgent cares. We had 0 in 2021 when Piedmont bought these two hospitals.
Wow.
There's 3 in Macon, and then there's 1 in Dublin, Eastman, and Milledgeville. We've added 4 new primary care offices that comprises about 12 physicians, and we expect to double that over the next 2 years. And then we're expanding some of the services that we already had, making big investments in cardiology, orthopedics, and I've already mentioned primary care. Access to care is the #1 concern of Americans, and I don't think Macon's any different. It's access and affordability. And so as you think about that, the cheapest entry into healthcare is with your primary care physician. And then urgent care, then emergency care, and of course all those specialists. So there are some statistics that say people that routinely see their primary care physician have 33% lower overall health costs and a 19% less mortality rate. So you live longer, and it's more affordable.
As a physician, if you don't have a primary care doctor, you need one. And if you have one and you go see them and you listen to them, you'll stay out of the ER. And the ERs, as you know, you probably can go there, wait a long time. It's not a place you want to be unless you need it. And when you need it, They've got great ERs.
Steve, I want to ask you about this though. Whenever Piedmont came on board, talk to me about some of the advantages that Piedmont was able to bring with a lot of the resources that they had out of state to be able to bring into a community like this.
Well, I think first of all, Piedmont's focused only in Georgia. Now that may change over time, but our focus is the state of Georgia. We employ more Georgians than any other business in Georgia, about 47,000 people. 1,700 of those are in Middle Georgia and working in this area. And so when you're not distracted by a lot of other places, we're really looking at making Piedmont Healthcare a destination for care. So like you would think of MD Anderson or the Mayo Clinic, we want people to begin to think of the Piedmont healthcare system in that way. So even if there's a service that you don't need in Macon, Columbus, or Augusta, we may have that in Atlanta. And so we're all networked and we're really looking at where the best place to put those things are. So the example is we've expanded cardiac care here now, where really the only thing that you'll need to travel out of Macon for is a left ventricular device, which is somebody with advanced heart failure, or a heart transplant. Both of those that we do in Atlanta, and those programs are nationally leading programs.
Steve, whenever you guys talk about care close to home, that's one of the slogans that you guys have used before. What exactly does that mean for people here in Middle Georgia?
Well, that means when we look at the needs of this community, we want to have as many of the services that this community needs right here in Macon. So I think early when Piedmont came, one of the misperceptions was, well, they bought these hospitals and they're going to take everybody to Atlanta for healthcare. And the complete opposite is true. We divide our company up into clinical hubs. Macon is one of those clinical hubs. And by looking at it clinically, we look and say, what are the services, what are the healthcare issues that happen in Macon that may be distinctly different from Columbus or Augusta or Athens or Atlanta? And then we start to recruit physicians, develop services, and bring technology that can help prevent and treat those health conditions.
When you mentioned the 6 urgent cares, and 3 of them were in Macon, where are the locations in Macon?
We have one on Ingleside Drive, so if you go to the Society Garden or Ingleside Pizza, a couple of favorite places for people in Midtown there, it's just right across the street. We have one on Zebulon Road out by the Walmart, and then our newest one is on Thomaston Road next to the new Publix out there. We've got some more locations planned. Right now we have 3. I would expect we'll probably have closer to 6 over the next couple of years, and then we'll add another 3 or 4 in some of the other communities that we serve: Monroe County, Jones County, Houston County.
Are they open every day?
They are open 365 days a year, and they're open from 8 a.m. to 8 p.m., and they're open on every holiday. So
Wow.
Again, we want to make sure patients have access to care. And urgent care is not the cheapest, but it is cheaper than ER care, and it can really meet that need for those low-level things like sore throats and sprained ankles. And
So a cardiac emergency goes right to the hospital.
Yeah, when in doubt, go
Right.
to the ER.
Right, 911, right?
That's right. That's
Okay.
right.
Steve, we have more questions for you, but first we have to take a break to hear a word from our sponsor.
As a nurse practitioner, I spend hours standing in the operating room. Plus, I'm a wife and mother of 5. My focus has always been others, not myself, until I started experiencing leg fatigue and horrible leg cramps at night. It was time for me, and as a healthcare professional, I knew exactly where to go. I reached out to the only accredited vein center in Central Georgia that treats veins exclusively. I wanted the best, and that was Vein Specialists of the South. My first concern was whether insurance covers vein care, and I was pleased to find that it does. Meeting with Dr. Harper and the team, they listened to my concerns and developed a treatment plan that was perfect for my busy lifestyle. When my treatment was complete, I was impressed with both the experience and my outcome. Now, at the end of the day, I marvel at my endurance. As a nurse practitioner and a patient, if you need vein care, I encourage you to call Vein Specialists of the South today. You won't regret it.
Piedmont Macon is proud to be your partner in healthcare, in business and in the community.
From our 2 convenient hospitals and ERs, our cardiac program, women's services, and urgent care centers, we provide Middle Georgians with comprehensive care close to home. Our goal is to empower you through great care that's simplified, unified, and easier than ever to access. Our mission is to make a positive difference in every life we touch. We want to be part of your family and your life and to make our community a better place to live.
It's a new season at Raffield Tire Master with huge savings on Michelin and BF Goodrich tires. For a limited time, you'll save $180 with paid installation when you purchase a set of 4 new Michelin or BF Goodrich passenger or light truck tires. Spring is the perfect time to enjoy the outdoors. So before you hit the road, head to one of our 6 Raffield Tire Master locations in Macon or Warner Robins and log on to RaffieldTire.com for more savings.
Raffield Tire Master.
Flint Energies knows safety is the backbone of reliability. To deliver the power you need means doing things right. So we can continue to provide reliable energy and peace of mind. Because safety runs through everything we do. Flint Energies is a Touchstone Energy Cooperative, your source for power and information.
Come have some real family fun down on the farm at Lane Southern Orchards. Grab a rocking chair on the porch while the kids play on a farm-themed playground with real tractors. Stroll through our huge indoor roadside market filled with fresh produce, gourmet treats, local wines, craft beers, and authentic souvenirs. Enjoy breakfast and lunch at the Peachtree Cafe. Make sure to save room for our homemade peach cobbler and ice cream. Open daily. Take I-75 to exit 142.
Cramping, burning, swelling. Don't let varicose veins ruin your personal best. Get back in the game with Better Veins for Life and improve strength, energy, and performance. Walk in, walk out at Vein Specialists of the South, where getting back in the game starts. Call Vein Specialists of the South today.
Hey guys, welcome to Vein Specialists of the South, and today we're interviewing Kristen, and we were talking before how long we've known each other a long time, haven't we?
We absolutely have, yes.
So we were trying to figure out when you first came to see us. It's been at least 8 or 9 years or so.
I think it's been 8.5, 9
Right.
years. It doesn't seem like it's been that long, but
Right.
certainly it has.
Well, tell us what was kind of going on when you came and some experience you'd like to share with us today.
Sure. I work as a claims adjuster. I still do to this day, but sitting at a desk all day, starting to having some leg pain, thought maybe I just need to be standing up more often. Did that. The pain really wasn't going away, so I thought maybe I'd come in, have y'all check out, make sure everything was okay. I was working out, but I just had that pain, just soreness all day long. Y'all did the scans and said, well, it's probably your veins that are causing that, which never even occurred to me. Right. I just, upon a recommendation, hey, go see Dr. Harper. So I was surprised to find out that that's what was causing it, and there was actually going to be a way of fixing it, because I thought it was just something I was going to have to deal with forever. The experience was very easy, painless. I mean, I was back to work within a day. I couldn't have had better things to say about it.
Now, you enjoy working out? You
Yes.
still working out?
It's not as often as I should be, but yes,
Yeah,
I do.
I need to do a little more myself also. So what did you notice about life after working on your veins?
They looked great. That was, because you don't realize the pain is also kind of affecting how they look as well. And that's, of course, now I see myself looking at other people's legs like, oh, they should probably go see Dr. Harper. And, occasionally mentioning something, nicely, but diplomatically at the same time. But they looked better, and I felt a lot better too. And
Cool.
Like I said, I wish I'd done it sooner.
Good. Anything that you would like to share with anybody out there that's maybe interested?
Absolutely. Make an appointment. You'll get in fairly quickly. The results happen quickly. It was the easiest task any medical thing I've ever done. It was the easiest thing I've done. I'm glad I did.
Well, it's our pleasure to take care of you. I'm glad
Thank
you've
you.
done well, and wish you the best of years with Better Veins for Life.
Absolutely.
Right.
Thank you.
Welcome back to Talk of the Town. Dr. Harper here with Steve from Piedmont Macon, and we're having a great discussion. We're over the past few years, honestly, the heart care has been in a transition in Middle Georgia. So tell me, I think y'all are making some strides to fix that. And we're really thankful for that, by the way. You want to share what's going on with heart care?
Yeah, it's back to that care close to home, and there's been some things not readily available here in Macon, and there's some new technology that we've brought. A lot of people my age, and I happen to be one of those people that suffers from atrial fibrillation, and we now have a way to treat that doesn't require you to take a lot of medicines. It's called the Watchman procedure, so that's fairly new to Middle Georgia. Leadless pacemakers, so no reason to implant wires and have all the potential complications that come along with that.
Wow.
And then our recent one is we brought a new structural heart physician. So when you think about the heart, we do the plumbing, that's the cardiac catheterizations. We have the electrician, that's the electrophysiologist. And now we have the structural cardiologist that can really deal with issues of the actual structure of the heart, like valve replacements. And now locally you can get a transcatheter aortic replacement. So no longer do they have to cut your chest open. Now they go through an artery or vein in your groin and go up to the heart and replace that. So those are things that a lot of patients used to go to Atlanta for. Mitral clip, again, a defect with the valves. So we just continue to bring new things here and new technology, and it's pretty exciting.
Good. Steve, cancer goes so far beyond just the operating table and what people are actually physically dealing with. Talk to me about some of the programs that you guys have and the importance of participating in those programs if you or someone close to you has been diagnosed with cancer and you're dealing with the fallout from that.
Well, good point. You know, even once the surgery or the treatment for when the cancer is done, there's a lot of psychological impact, and a lot of people lose social connections during that time. And so wellness programs and survivorship programs kind of help reconnect those folks. But we are blessed to have some very talented nurse navigators in our cancer center, and they walk our patients through this very complex maze of appointments with physicians and getting them connected with resources, and that we don't charge for. So even if you're not our patient, our nurse navigators will work with you and help you navigate that disease and hopefully the cure of that disease, which we continue to advance every day. You know, cancers that people used to die from or suffer for a long time can now, if caught early, we're back to that primary care.
The primary care
physician,
thing.
getting those screenings done and seeing them early, we can prevent a lot of that suffering.
So I want to ask you this. I'm 35 and I do have a primary care doctor, but I bet half the people my age that I know that are in my immediate friend group do not. What message would you tell someone that says, hey, I'm young, I don't have to go to a doctor, that's for midlife whenever I get old? Like what message would you guys say to someone like that?
Well, there is a staggering new trend in the 30-somethings with colon cancer. And it is exponentially growing in that 30-year-old group, and it's very concerning. Colon cancer, if you catch it early, can be cured. And so if you're in a high-risk group, if you have a family member that's had that, again, going and seeing that primary care physician and them knowing not only your history, but your family history can tip them off to look for things and to ask you questions about symptoms that you might have, but that you overlook or you brush off as, I just had a bad day. And so they could pick up on those subtleties that maybe you yourself would not.
Wow.
So share a little bit about some of the community screenings you do, and also about women's services that are offered that people should know about.
Yeah, to community screenings, again, diabetes is an epidemic, and again, it's no stranger to Macon, so we do a lot of screenings around diabetes. Hypertension is a silent killer, as you know, Dr. Harper. Right. People walk around with elevated blood pressure that they're not aware of. And so, again, things that if you're seeing your primary care doctor, they can catch early and begin to treat that. We do prostate screenings from time to time. So we're trying to look at all those cancers or precursors to cancer that we can detect ahead of that, and again, hopefully have a much better outcome and survival rate.
So how does the local community find out about those screening opportunities?
Well, you can go to our webpage, and there's a multitude of resources on there. You can find out what screenings we're doing. We're on social media. If you go to our webpage, not only can you find out the screenings we're doing and get some education, you can book an appointment with a primary care physician yourself.
Okay.
So no longer are the days where you call the office and they tell you when they can see you. Our physicians will allow you to schedule your own appointment on the day that's convenient for you and the time. And post pandemic, we have virtual visits now. So a lot of times you don't even need to come to the office, especially if it's, again, something minor. You just want to talk with your physician. Your primary care physician can receive just text messages from you through our website. So we continue to build that out as a portal for healthcare. You can access all your medical records there as well.
Now, speaking of your social media, you guys have one of the coolest programs to me that I was reminded of earlier when I was looking at your Facebook page. You guys have what's called the Community Hero Award, and you guys just gave an award, I believe, a couple weeks ago. For those in the community that might not be familiar with it and the important work that you guys do with that, can you tell me a little bit about that?
Yeah, again, during the pandemic, when our staff was really having a hard time, our community stepped up and they came and sang, prayed, flashed their lights, sent food to the hospital to support us. And so when that was all over, we said, there's a lot of other heroes in this community, and many of them don't get noticed, and the work they do is really important. And so we decided to accept nominations not only from our staff, but from community members through our webpage, and find those nuggets in the community that are really making a difference. And we try to bring that to light. And a lot of these people, what they do out of their own pocket, and sometimes that allows other people in the community that can connect with that work that they're doing and help them.
Hey, Philip, when I drove up here, I'm at Piedmont Macon North Hospital.
Yes.
In the heart of North Macon. And actually, my first office was here. I was the first surgeon who had full-time practice here in general surgery. It was a few months after it opened, and I spent 16 years working at this hospital. But anyway, tell us a little bit about this facility.
Well, we've really tried to be intentional about Piedmont Macon North and make it in more of an elective surgical and outpatient center. It's a lot easier to access. There's no parking garages, and the walk from the parking lot, if you have to do that, it's close. And so it's just a good environment for that. So we have now aquablation, so a treatment for enlarged prostates that we do here. We have a robot for general surgery, way before your time, Ken. And we'll be bringing an orthopedic robot here. So really, all things that can facilitate an easy in, easy out, and high-level surgeries for
And
patients.
fully supported ER, too.
Fully supported
24/7.
ER. A lot of people don't realize, but the ER here at Piedmont Macon North sees almost as many patients as Piedmont Macon Medical Center. So we
Really?
see about 50,000 people there and about 45,000 here. So that's a lot of patients.
So Steve, we talked about the locations of the urgent care facilities earlier. Talk to me about where your primary care locations are at.
So we have 4 open right now. One is on this campus at Piedmont Macon North Hospital. We have one at Piedmont Macon Medical Center in the medical office building there. And we have a beautiful new one on Bass Road. And then we have one right now in Houston County off Russell Parkway. We've got more planned both here in Macon and in Houston County. And again, we're looking at Gray and Monroe County from some of these outer areas, so people have to travel less to access those services.
So if you're in Macon, you are close to one of your primary care offices.
You can get anywhere in Macon in 10 minutes.
That is true. That's
and
true.
so we want to have offices that are just that close.
So the audience may not be aware, but of all the medical school students that graduate every year, sometimes there are not enough opportunities to get a good residency program. And also, that's the future of the people who are going to be providing the primary care and the specialty care. What has Piedmont done to address that?
Well, we have about 80 residents at Piedmont Macon Medical Center, internal medicine and psychiatry, and then some of they call a transitional year, so a year that some specialties have to do before they enter that. Residency is really important. As we talked earlier about the shortage of physicians in Middle Georgia. We're about 100 primary care physicians short.
Wow.
Those internal medicine residents will fill a lot of those roles because we know statistically people that perform their residency stay within 100 miles of that.
Really?
And so we have GME obviously here with Piedmont. We also have it in Columbus and Athens. And with the new medical school at the University of Georgia, we're expanding GME to Augusta, Atlanta, and some additional in Athens. So that's an important part of access to care is having the physicians to fill the roles that we need.
So Steve, you were talking earlier about how Piedmont is actually a 501c3, and so it's a not-for-profit organization here. Talk to me about how the community can get involved to help address some of these problems and begin to help solve them.
Well, as a 501c3, we do have a foundation, and that's a way people can invest in us. Piedmont has invested over $200 million in this community in the last 5 years. And so they have the means to help us. But when big things happen, things that are kind of not things that we think about a lot need to happen. A lot of times philanthropy provides that opportunity. The Marcus Tower in Atlanta, the Amos Children's Hospital in Columbus. And I think we would invite the community, if they like the care they're getting and there's a way that they want to give back, our foundation is one of those ways. And it's not $5 million gifts a lot of times, it's 100, 1,000. There's a lot of things that small amounts when accumulated together can make a big difference.
And that money stays right here in
And
Middle
that
Georgia,
money
right?
stays right here in Macon. So money that's donated on behalf of the Macon hospitals will be spent right back here in Macon.
Steve, thanks so much for joining us this week and for participating in this interview. We really appreciate it.
Thank you.
And thank you guys for joining us as well. And stay tuned because you never know where me and Dr. Harper might show up next.